Coronavirus booster shots will be available to all adults from Sunday at private vaccination centers. That's what the government has announced today. These will be paid booster shots for 18+ age group. Booster doses so far have been given only for health workers and 60+ age group. Now, over 2.4 crore booster or precaution doses have been given so far. That's what the government has announced today. This order, however, means that unlike the booster shots announced for healthcare workers and frontline staff and those above 60, the third jab will not be free for most adults because these will be paid booster shots. The decision to open up the booster doses to all adults comes as infections grow in many countries and some Indians find it hard to travel abroad without a third dose. Let's go across to Meher Pandey to understand the ramifications of this. Meher, so a relief for all those adults who've been waiting for this booster shot. Take us through the details. Also, that the 9-month gap between the second and the third shot, does that remain?
Yes, Rohit. So this is very welcome news for the vaccination drive. Now all adults can get the third dose after 9 months of taking the second dose. The important thing to clarify now is that these will be paid shots and adults can take them at private centers 9 months after their second dose. They will still need to access this through the CoWIN portal, register, etc. But these will be paid shots. Now, so far the vaccination drive has kept boosters for people over 60, healthcare workers and frontline workers. So those booster shots will continue to be given for free, but these precaution doses for all adults from the 10th of April, which is the Sunday, will be at private centers. Now, what this means is that these shots have been called for a very long time now, and finally this decision has been taken. What the paid booster shots mean is that anyone over the age of 60 age of 18 can get the booster shot, the definition of a precaution dose has not changed. Anyone who's taken Covaxin will take Covaxin for their third dose. Anyone who's taken Covishield will still take Covishield for the third dose. The 9-month gap has been questioned because it is very, very wide. But the science so far seems to say that only after 9 months will it's very clear that antibodies from the first 2 doses will actually drop. So to be on the safe side, the government has kept the gap this wide. But it is a very wide gap, and maybe many people who took the second dose late last year won't be eligible yet.
All right, Meher Pandey, we leave it there. Thanks very much for joining us with those details. Let's take this to a panel of doctors. Joining me right now is Dr. Rajesh Parikh, Director of the Medical Research at Jaslok Hospital in Mumbai. Thank you, Doctor, for joining us this afternoon. Also joining us is Dr. Rajeev Jayadevan, member of the National IMA Task Force on Coronavirus. Thank you very much, gentlemen. Dr. Rajesh Parikh, what's your reaction to this step? Was it inevitable, or it has come a bit too late? Should it have been opened earlier?
Well, it certainly has been inevitable. I'm delighted that it is here, and it's always better late than never. Yeah. I don't think it's too late, but certainly it is about time.
Yes, Dr. Parikh, the question is, do all adults need boosters?
I would think so. I would think that all adults need boosters, and in some time it's possible. I'm not sure, but children might need boosters too.
Yes, Dr. Jayadevan, let me get you into this conversation. Have you seen any pattern in vaccinations, particularly at the private centers? Because this is opened only at the private centers. So are people coming into the private centers to get their second dose and their booster shots?
Well, at this time, because India is in the ebbing phase or the low phase of the pandemic, it's a cyclical pattern. The demand for vaccination has clearly come down for many reasons. Firstly, most people have been vaccinated. For instance, part of India that I live in, most adults are vaccinated. So the demand has really come down, and the demand for a precautionary dose has not been overwhelming. But that demand can vary depending on what phase of the pandemic we are in. For instance, if there is a threat of a wave or a surge, then that demand will go up for sure. So that is the state we are in. But it's a decision that comes in, which is seen as a welcome move by many people in India, because they Many of them feel that they need a precautionary dose or a third dose because the rest of the world has moved on into receiving third doses. But that being said, the data from the rest of the world is mainly on mRNA vaccines, and their primary vaccine series is mostly mRNA based. So the pattern that we use in India is quite different, and the boosters we use in India are different. So we don't have a lot of data on how they will perform, but we do know that these vaccines, primary series, protect everyone very well, especially healthy adults are well protected with just the primary series.
Yes, and Dr. Jayadevan, do you see there is a change in policy by the government? Because there have been demands from certain sections to open up booster for all adults, especially those wanting to travel abroad.
Yes, there is a demand for people to receive extra doses. As you rightly said, people who visit our country from abroad, they have requested it. And so also our own citizens many people have different perspectives about their own health. Some of them want to go the extra mile and they believe that this third dose will help them. So such people also have raised a demand for it, which is why it is seen as a welcome move by the public.
Dr. Parekh, let's talk about this 9-month gap between the second and the third dose. Do you think that should be reduced or is that fine?
I think it's okay. It could potentially be reduced by 2 or 3 months, but I'm reasonably sure that the people who have made the decision have looked at all the data from across the world and collated that along with our own capabilities and requirements. So I think it's probably a fairly neat balance between what might be ideal and what is practical.
Also, Dr. Parekh, suppose someone has COVID, after how many months can that person take a booster shot?
Well, 4 to 6 months is fine. Okay. One should also keep in mind that COVID, in its own way, contracting COVID, does confer an additional immunity, though one shouldn't bank on it completely. So between 4 and 6 months would be a reasonable time to wait after a documented COVID episode, mind you, not just something that one suspects, to take the booster.
Dr. Jayadevan, there are concerns of these new mutations of coronavirus, including the XE variant, which WHO has spoken about recently. Do you think in the wake of that, these booster shots are necessary now?
Well, I think for our viewers, I think they need to understand that the claims of waning immunity or decreasing immunity are not true. What is decreasing are the antibody levels, which will naturally contract after every infection, after every vaccination. Your protection against severe disease and death has not decreased. So that is one thing that we must realize. But at the same time, if we pick up the infection too many times, it may obviously create a proportionate number of bad outcomes. So that is where the new variants come in, because we know the virus is continuously adapting. And it's a natural part of its evolution, which means that it's able to evade the previous immune response and cause an infection. But those who are vaccinated or previously infected are far less likely to die than those without prior immune memory. So the XE variant is just Omicron, which is slightly tuned up version. It is not a matter of great concern because the total number of cases it's not very much, and it is not a more severe form. What would be concerning, though, is if hypothetically in the future a biologically different variant arrives, and we are hoping that will not be the case. But as of now, there is no need for excessive concern, especially for those who've been fully vaccinated as of now.
Right. Dr. Parekh, you agree with that? Also, if I may add one question of mine, of course, the government will take a final call on that, but do you think that mixing of vaccines, if a person has taken Covaxin as the first couple of shots, can he go for some other vaccine? Can that option be looked at by the government or their advisors?
Yeah, it certainly can be looked at. It is something that is advisable. But if you look at the data, the statistics in our country, it's almost certainly not a practical solution because nearly 90% of the people in our country have got Covishield and, the balance is Covaxin. So it is relatively easy for somebody who's got Covaxin to get Covishield rather than the other way around. Having said that, getting a booster from the same platform from which one has received an earlier vaccine is not a bad thing at all. I mean, that too confers immunity.
All right, Dr. Parikh and Dr. Jayadevan, thanks very much for joining us in this conversation on the booster shots. So booster shots available for all adults from this Sunday. These will be paid booster shots at private vaccination centers.